when you watch this video, you can see that the lens is, there's a lot of sonulopathy and there's a lot of phacodonosis. And you can see here while doing the capsulorhexis that the anterior capsule is wrinkling. And basically you can actually see while performing the capsulorhexis that the whole lens is moving, as you can see here. So naturally it's not that easy to perform the rhexis. And usually rhexis in these cases often becomes smaller than intended. But we managed to get a good size on the rhexis here, as you can see. Following the rhexis, what we're going to do is we're going to do a viscodissection. And basically it's important to put in the viscoelastica under the anterior capsule, as you see here. And it's important to put it nicely, in all four corners, because what we're going to do is we're going to use 4 capsular retractors, and we're going to put them evenly. And as you see here, you can basically tuck them in, and you can move them forward the anterior capsule and retract the capsule, as you see here. And that you can go do in all 4 areas. If you use all 4 capsular retractors, you get a nice and even tension on the capsular bag. So in my experience, the capsular bag is usually very stable and the lens is stable during the cataract surgery. Even in patients with more than 180 degrees of sonal lysis, with this technique, you have a very stable bag. And what you can see here is that the hydrodissection goes well, and we're doing the phaco in a stop and chop manner here. And we're not going to dwell on the phaco surgery itself, but just to demonstrate, that even though you add a little bit of pressure on the lens, because you have the retractors, they're actually able to keep the lens in the center, as you see here. Basically, I think the retractors in this case really helps us to perform the phaco surgery in a very safe manner. And what you're going to see now is that, of course, we're going to take out the lens with phaco surgery. And after that, we're going to actually remove the retractors, as you see here. And here I'm showing you how to remove the retractors through the main incision. And this was quite common to do with the first edition of the capsular retractors, but with the modification coming along, you can actually take them out through the side incisions as well. So basically here we're going to use the IA to take out the bag, and then performing an anterior retractomy, as you see here. And then we're going to put in a little bit of myocol, and after that we're going to put in the iris claw lens. Basically the iris claw lens you can put in front of the eye, in front of the iris or behind the iris. I prefer to use the iris claw lens anteriorly, as that's the manufacturer's advice. In that way, at least in theory, you get a cleavage of the iris, so there's usually a nice gap in the iris claw lens, which can protect the corneal interstitial. Basically here we tuck in the iris claw lens through a 6mm temporal incision, and then we use a Vacofix to enclave the iris, and here we use the left Vacofix on both sides actually. As I'm sitting temporal, that's actually easier to do it this way. Suture the cornea and the case is done. This can be done with viscoelastics or with the AC maintainer, as dependent on the case.